Hey guys, Luke here from Body Zest. We are an osteopathy clinic in Banstead, which is just below London in Surrey. And today I'm going to be answering the question of, does hypermobility cause lower back pain? And I want to emphasize the word cause there, because a lot of people assume that because they have hypermobility and because they have back pain, that the hypermobility is the cause. And it sort of implies that if it's the cause of it, that there might not be a solution because they're always going to have hypermobility. So does it cause lower back pain? Let's get into it. Right, so just before we fully get into the details of it, I treat a lot of people with hypermobility because we treat a lot of chronic pain patients here at Body Zest. So chronic pain being something that goes on for a very long time. Chronic pain is often vague. You can't quite pin it down to one thing. It moves around. And a lot of patients that have hypermobility will experience that kind of vague pain. You know, it's like, oh, it started to feel better in one place and then it sort of moved to another and then it flared up a little bit here, but then it went away there. It's not a perfect like, oh, I've just got this particular spot and, you know, we can reduce the pain with a little bit of treatment. It's just a little bit more kind of like moving around the body and hard to put your finger on. So what is hypermobility? Well, hypermobility itself is actually just ligament laxity. So bone, they make a joint. Covering that joint is a ligament, okay? It's not attached to the muscle like a tendon is or anything like that. And the point of the ligament is to stabilize the joint, and actually there'll be a range of motion available at the joint, and the ligament will be part of the reason why it won't go any further. Now, if you imagine if that ligament is a little bit lax, then all of a sudden that joint can go further than the normal person can, which is why, you know, you'll see that hypermobile people can take their hand further back, take their fingers further back. Maybe they can put their palms on the floor, you know, their elbows do more than mine do. Yeah, those ligaments aren't holding those joints in place in the same way that other people's are, and therefore they're starting to get a little bit more movement through the joints. Now, why can that cause people pain? Well, I think a lot of people assume that the total amount of movement going through is creating a painful joint. But actually, I mean, that could occur, obviously. But actually, I think that from my experience, the majority of what I see in people with hypermobility is actually that their pain is being caused by the muscles. And this is where differentiating between does hypermobility cause lower back pain is going to come into it, because the hypermobility itself isn't necessarily causing the back to be painful. And if we were to say that hypermobility causes lower back pain, then everyone with hypermobility would have lower back pain, which they absolutely don't. Loads of people work out ways to manage this. So if that isn't true, then it's more likely that hypermobility causes something and then your body can either cope with that something or it can't, i.e., you're either conditioned to cope with hypermobility or you're not conditioned. And if you're not conditioned to cope with it, you'll get lower back pain. And if you are, you won't. It's subtle, but that is a big difference between saying that hypermobility causes it, which suggests that there's nothing you can do. So what's the thing that hypermobility causes, which then, if you're not conditioned to it, can cause lower back pain? It's muscle tension. So part of what the muscular system does in the body is it helps to stabilize joints. And as we've discussed earlier, there is a problem with hypermobility in which the joints are going slightly further than they ordinarily would through that range of motion. And the way that your brain perceives that is as a state of instability. So your brain, being very clever, wants to try and support your joint to offer it stability. The way that it does that with anyone, hypermobility or not, is using the muscular system. The muscular system is a dynamic stabilizer of joints, and it will contract and it will tighten and it will try and work out ways to help support the joints and keep them where they should be in a dynamic way. It's going to engage them in different ways as you move to make sure that they don't fall out of place. Now, this is where it gets interesting with people with hypermobility. So we know that the joints are moving further than they should. We know that the muscular system is part of the support structure for those joints. If your joints are moving further than they should and your body is perceiving it as instability, then we've kind of got two roads we can go down. If the muscles around that joint are strong, then your body is going to know that the stabilization required for that hypermobile and too movable joint is going to be just the strength of the muscle. Like, okay, we're all good. We know that the strength in the muscle, the conditioning in the muscle is going to lead to enough stability in this joint and we can relax. The other road that you can end up going down is that you don't have enough strength in the muscle. So therefore, what the body's going to do is it's going to say, okay, well, the next best thing, if I haven't got enough strength in the muscle, is that I tighten the muscle around the joint to try and create stability like that. And that is where we see chronic muscle tension in loads of patients who are deconditioned, but particularly in hypermobile patients. Your brain is essentially trying to help you, and it's identified that you haven't got the strength to help to stabilize the joint. So it's saying, well, don't worry, I'll come in and I'll tighten the muscle around it. But tight muscles get painful. They don't have as good blood flow through them because basically, like if a muscle's tight, then it hasn't got the contractile function that a normal muscle does, where it's not pumping fresh blood in and out of it in the same way, because that's what muscle contraction does for the body. And any living tissue basically builds up crappy substances and they're not getting cleared out as easily. So they become irritable, and tight muscles generally are more prone to being irritated than, nice, malleable, loose muscles are. So this problem of muscle tension is then something that people come and see us about for hypermobility. And if all we do is try and lengthen the muscles by doing soft tissue and giving the person stretches, we never actually deal with the root cause of why this is happening because of the deconditioning, and therefore the problems will just continue. So the way that we would always have to approach this is to say, yes, we can do a bit of hands-on stuff, and yes, we can give you some ways to try and lengthen these muscles and get them feeling a bit better, but it has to be done in conjunction with strengthening through the area. If you don't do the second part, then the first part is going to be an incredibly short-term effect, and the person is essentially just going to have to keep coming back for very short symptom relief, and eventually they would just get bored of us and stop coming. So strengthening through your muscles is the ultimate way to build stability, and the ultimate way long-term to make those muscles that are tightening up to try and stabilize switch off. Now, strengthening of muscles, if you're in a really, really hyper flared up state, is something that's going to be quite difficult, because trying to contract a muscle which is very angry at you already and very irritable is not an easy thing. So the guidance there would be that if you can try and stimulate a little bit of symptom relief before you start on this, even if it is short term, you create yourself a window of opportunity, basically by reducing the symptoms, getting a little bit more length through that muscle to then be able to start to strengthen it up without it getting really, really angry at you. And then that's your foundation for you to be able to build off and start to build that strength. Yeah, I hope that helps. That applies to lower back pain, but of course that applies to any other part of the body that you're hypermobile in and you're getting that problem with. And it also applies to people that haven't got hypermobility and are frankly just under conditioned for the demand that they're putting on their body. So the most common thing we would see that with that is hamstrings. People got tight hamstrings and they stretch them and get them massaged and they never clear up, and it's just because the hamstrings are tightening because they're trying to essentially keep them upright, and they haven't got the strength to do it. So that's the next best thing. So this is applicable across lots of different conditions. Cool, guys. Hope that helps. If you want more advice on general stuff like this, you know where to get us.